Okay, the board meeting is going to go live in 5, 4, 3, 2, 1. Amy, I don't know if you heard, but the board chair will not be on. So Matt's going to, I don't know if he's going to want us to run the agenda, but obviously I'm guessing he'll have to be the one to call out the, I guess the approvals and everything. But anyway, I'll leave that between you and Matt, how y'all want to do that.
Are you there, Matt?
Amy, I'm open. Whatever works best for you guys. I'm kind of back and forth here at work, but I can jet over here and do whatever I need to.
Okay. Why don't you just, can you start and call for a roll call, and then we'll see if we have a quorum, and then we'll decide how we need to proceed.
Yeah, so welcome everybody that's here, and I guess officially call to order. I don't know how many we have to have a quorum.
I believe it's 7. There's 12-member board, so we need half plus 1. Shannon, do you want to do a roll call for us and see who's here? Make sure we have enough.
Sorry, had trouble getting unmuted. Gail Callan, Matt Jackson.
I'm here.
Okay, Chantilla Rexroad, Janella Brown.
Here.
Billy Coffey.
Here.
Leanne Jesse.
Here.
Gary Pardon. James Bergen. Jacob Burton.
He's here. He'll be right back.
Okay. Debbie Cowan. Catherine Feast. Sherry Hutchison.
That'd be 6, Shannon.
Yes.
All right, who else on that list were you showing that was supposed to be on?
Debbie Cowan. I knew Catherine Feast and Sherry Hutchison had said that they probably would not, but the other 2 had not told me a no. They had talked like they would be on.
If you have Debbie's contact, you may want to reach out and just see if she's having trouble getting on or something.
Okay. Okay.
Ron, it's my understanding, and Judge Cowan may be a better parliamentary procedure person, Robert's Rules of Order, than I am, but I believe we are allowed to discuss. We're just not allowed to do any business. So the first items on the agenda are actually health education updates and diabetes report. We could potentially go through that while Shannon's trying to reach out to someone before we get to any business items. Judge Cowan, am I wrong about that? Is that what you're understanding?
I'm not real sure, but I know when we don't have a quorum, we don't do anything. So
Nothing at all? Okay.
let me text Debbie. I've got her cell number. I'll text her and see if she's going to be able to get on.
I just text her, Gail.
Okay.
I haven't heard back yet.
Hey, Amy, last 2 years ago when we had our Adair meeting, and once again, this may not matter. Now, this might have been a different situation because we knew a 7th one was coming, like they were physically driving there. They were like 15 minutes away. So when Sean heard that, they didn't call the meeting to order, like you said. They just, they did a few of he did his own presentation, Sean did, and then he let the air people do their updates, but there was obviously no call to order. There was no approvals or anything. So whether or not that was in the rules, that's what we did 2 years ago. But like you said, if he knew somebody was coming, if we don't know anybody's coming, that, the health education, they might have to do the report again. You know what I'm saying? So that's up to you guys.
I took Robert's Rules of Order training back in the fall, and that was what we were told there, is that we could share information. We're just not allowed to conduct business in a meeting like this. We'll hold off just to be sure. I don't want to do anything improper.
She says she'll be on just in a second. Debbie Cowan. Did you hear me, Amy?
Yes, I did. Thank you,
Okay.
John.
You're welcome.
She just texted me as well and said she was getting on. Debbie Cowan. Haven't heard from the other two.
I'm going to close the door to my office while we're waiting, so
Please.
nobody walks in.
I think we usually elect officers while they're absent, correct?
Shannon's it raining there? It's absolutely pouring behind us here.
Yes, it's pouring and the wind's blowing. It's a nasty day. She's logging in now, so she should be on momentarily.
Welcome to the meeting, Debbie. I think she's here now. Shannon, does that make a quorum for us? She says yes. I see her head shaking.
Sorry, yes, I'm having trouble with my mute button.
Okay. Matt, do you want to go ahead and call to order then, and we can proceed?
Yes, ma'am. Welcome again, everybody. Go ahead, Ron.
Sorry, man. I was just going to tell. I was just going to tell Debbie Cowan. It looks like she don't have a speaker beside her name right now. If you can hear me, Debbie, if you don't have a computer speaker, you do have the option to call in. You can find that information on your options at the bottom. It'll give you the meeting info, and you can call in using a phone. But obviously, if you're not able to do that, you can type your answers and comments into the chat as well. I was just letting you know that. Sorry, Matt.
Oh, no problem. I was just going to call the meeting to order, and I guess the first item of business is to approve minutes from last meeting. Anybody would make a motion for that?
I think we actually have two sets of meeting minutes to approve, and they can be done at the same time, I guess, with one motion to approve both. But there was a special called meeting also last year, it looks like. Okay, let's
Make a
do.
motion to approve both sets of minutes, the regular minutes and the special call minutes.
Thank you. The motion, is there a second?
I'll second.
Okay. Matt, we have a motion and a second. You can call for a vote if you're able to.
Yeah, does everyone agree? You can signify by saying aye.
Aye.
Anyone opposed?
Okay. Sounds like motion carries.
Like the motion carries, and with that, I'll turn it over to Ron or Amy to sort of run the agenda here.
Debbie, I know Ron talked to you about making sure you can hear us. Can you give me a thumbs up if you can hear me at least? Oh, she's connecting. Okay, good. Connecting to audio. I don't want to go too far into the agenda till I know she can hear us and can communicate. Okay, I'm going to work with Debbie. I'm on. Oh, you're good. Okay, perfect. Excellent. Okay, the first item then on the agenda is the health education update. So I'm going to ask Ms. Jelaine to go ahead with her comments, please.
Thank you, Amy. So as most of you all know, back in 2018, we completed a community health assessment. And from that, we chose 4 priority issues to work on and came up with our community health improvement plan to work on those. We're now in the process of updating, updating the data. All of this will be available on our website next week. Our community health improvement plan will also be available. The issues of concern that we're looking at are substance use, tobacco, obesity, and physical inactivity. And as I reviewed the newest data and compared it to 2011 data, we had some noticeable lower rates in smoking, children in poverty, and teen births. Our excessive drinking rate almost tripled. We had, of course, obesity continues to rise, and we have an alarming rate of grandparents that are responsible for their grandchildren. So, of course, the goal of our health policy and promotion department, or health education, as most people refer to it, is to address these issues and just do our community programs and community health. Our encourage you guys to look at our website. There's a lot of information on there if you haven't looked at it. Something new is our new COVID quarantine isolation calculator, which I think a lot of people are starting to use. And we also have a really nice teen health page. We're doing our programs by Zoom mostly. We're doing school programs by Zoom. We're doing our health coalitions by Zoom, our Board of Health meetings obviously by Zoom, but we are still providing our services. So if you guys ever have a need that I can help you with, just give me a call and I'll do everything that I can. Thanks. That's all I have, Amy.
Thank you, Jelaine. The next item on the agenda then is the diabetes report, and our diabetes staff members are not able to be with us today. They have provided some information, I think, that was in your board packet. So it's right after, in my packet, I guess it's the same as yours. It's right after the minutes that you just approved. That next document there, it's on LCDHD stationery, and it says Population Resources 2021. This is specific diabetes information across the district, and Adair also. There's some numbers on there so you can see the prevalence rate, incidence rates, and get some information that you need there. If you have any questions about that, about our diabetes program, or about any of the numbers that have been presented to you here in this packet, you can let me know or reach out to Jelaine, and we can get someone from the diabetes staff to find answers for you for any of that. I apologize that they couldn't be with us today. We've had them on every agenda, and they've not been able to attend all of them. So if y'all have questions, as I said, just reach out. The next item would be old business. Does anyone have any old business they need to bring before the board? Okay, hearing none, I guess we'll go to new business then. Is there anything new business related that's not already an agenda item that you wanted to bring up or discuss? Okay, then hearing none, we'll go ahead to the presentation of the 2021 financial reports and the audit that has been done for Adair County. And I'm going to ask Ron, our Director of Finance and Financial Services, to go over that with you all. I can't hear you, Ron.
Can you hear me now?
Yeah.
Sorry. In prior years, we had sent out financial statements normally in the August, September timeframe. Due to y'all having an audit this year, and due to some other things too, sometimes it's hard to get them out by that time frame. Based on that timing, and since we do our local board meetings in February anyway, I thought it was a good idea to start giving your financials as part of your packet, so you have that if you have questions before the meeting, and also so I can start presenting them, because we normally didn't exactly present in detail the financial statements from the prior fiscal year ended when we did these meetings, at least since I've been here. So I'm going to start doing that this year moving forward. If you guys have any questions as I'm going through these financials, I won't go in every line detail, but I just want to give you all a general overall picture of how you ended June 30, 2021 for your financials, your balance sheet, and your budget. And then after I do the financials, I'll quickly go through the audit, and then if y'all have any questions about either, you can let me know, and then we'll go from there. I'm going to share my screen really quickly. Can everybody see my screen? Okay. I'm showing you a picture of the June 30, 2021 financial statement that was put together by me. We had at the beginning, so July 1st, 2020, we had cash on hand of $222,360. During the fiscal year ended June 30, 2021, we received total receipts of $250,504. That is comprised of all the things you normally receive: real estate taxes, tangible property taxes, motor vehicle, some delinquent, some telecommunications tax, and then of some interest income from your checking accounts. That gave you total cash available before expenditures for the year ended June 30, 2021 of $472,864. And then you had total expenditures for the year of $230,903. once again comprised of normal expenditures for maintenance and repair, your district management fee, your 2.8% to be a part of the district that's normally paid. A little bit of materials and supplies, not much. Dues and subscriptions like DeKalbo, KPHA, SPGE, some furniture and fixtures, and some budgeted equipment that was spent. That left you with cash on hand as of June 30, 2021 of $241,961, which you also see reflected on the next financial statement, which is the balance sheet. You'll see that here showing how much you have in your operating account. So I won't spend any time on that. That just reflects what I just told you. Moving on down to page 11 of your packet, which is the profit and loss budget versus actual for July 1st, 2020 to June 30, 2021. Once again, I've already read the actual column in detail, but you guys obviously have that in front of you. But I wanted to give you a general picture of how you finished compared to budget. If you remember last year, we actually budgeted a $38,000 loss, roughly, with some change there, $38,774 loss. You actually finished with a $19,601 surplus. But as you could tell from our expenditures, we didn't have a lot of bad things happen. We didn't really have a lot of repairs and things needed for the building. That obviously changes dramatically from year to year. Sometimes we have HVAC units go out. We have building issues, some electrical problems. It just varies from year to year. Obviously, you guys know how all buildings work and things like that. So we had a pretty quiet year. So I'm assuming if we had a more normal year, it would be closer to break even or even a loss for this prior year. But because you didn't spend a lot of the budgeted miscellaneous costs that we had budgeted and were able to save that went back into your budget, giving you the surplus. But you can see those in your packet in more detail, line by line, how we finished compared to budget. And as you can see, we met those in every category on here, and we exceeded them all in revenues as well. We had a very good collection year compared to how we budgeted. So all that very good news. Moving on to the audit. Now, I won't spend a lot of time on this because this is basically a reflection of the financials I just read to you. But you guys had to have an audit this year. Based on your total expenditures, you only have to have an audit once every 4 years. The rule of that is if you exceed $500,000 in expenditures, the SPGE requires you to have an annual audit. If you have over 500,000, but since you guys average less than 500,000 in expenditures every year, you're only required to have an audit once every 4 years, and that fell for June 30, 2021. Our auditors are RFHP LLC. We have used them for quite a while now. They do a very good job for health departments. They once again did a good job for us again this year. I did want to show you the independent auditors report to show you how they showed our internal control over our financials were, or how our financial statements were presented. If you look on page 15 of 29 of your packets, under the section called Unmodified Opinion on the Regulatory Basis of Accounting, it says, in our opinion, the financial statements referred to above present fairly in all material respects the assets, liabilities, and fund balances of the Adair County Public Health Taxing District as of June 30, 2021, and the respective revenues and expenditures for the year then ended. So as you can see, you guys had a clean audit in regards to your financial statements. Everything was presented fairly. Everything was clean. All the numbers were balanced. So everything was clean in regards to what they found on our audit. So that's good. There is another report that they have to report on. It's our compliance in regards to government auditing standards. I'll get to that in just 1 second. I'm going to breeze over the financials because once again, these are exactly what I've already reported to you. They're just in a little prettier auditor form here. Here's some of the notes, but I'm not going to go through these because these are the same notes that the auditor gives us every year. The only one I've been reading, because it's a newer note that they'll probably get rid of next year, is the note they started leaving during COVID-19. It's note 5 on page 19 of 29 of your packet. It says, since early 2020, the COVID-19 pandemic forced certain restrictions in the U.S. and the state of Kentucky. The economic impact of the pandemic could result in a negative impact on the taxing district's revenues. The duration and pervasiveness of the pandemic are uncertain as of the day of these financial statements. The taxing district is continuously evaluating the impact COVID-19 on its operations and finances. And I will say, even though they left that note and it could have happened, Our revenues, as you saw, actually were just fine and held good through the pandemic. Moving on to this last letter they leave us, which is how we complied with government auditing standards, our internal control related to government auditing standards. If you go to the last paragraph on page 20, under compliance and other matters, the very last sentence says the results of our tests disclose no instances of non-compliance or other matters that are required to be reported under government auditing standards, which means once again they found nothing in regards to our compliance for related to government auditing standards. So once again, a clean audit. So that's good. Everything looks good for Adair County. And that is all I have for the financials and the audit. For the financials, and if nobody has anything, this will be where Matt will ask for an approval of the audit.
Do we have a motion to approve the audit?
Motion.
Motion, do we have a second?
I'll second.
Thank you.
I know I'm got a 7-year-old, but I was like 13 when I had her. So I'm 80.
Sorry, I couldn't keep up with who made a motion and second, but I think we had one of each. If you're in agreement, say aye.
Aye.
Any opposed? All right, looks like the motion carries. Did you guys get notes on who made motions and seconds?
Shannon, do you have that? I think it was Billy Coffey and Jacob Burton.
Yes, that's who I got.
Okay.
Okay, thank you.
Okay, it's okay with Amy. I'll move on with the presentation of the budget. If you notice in your agenda, it actually says set the tax rate, but if you guys remember, we like presenting the budget to you first to give you the budget with the rates incorporated so that you can see how the budget is going to finish up and how you're going to finish up financially, but based on all of our budgeted numbers before you make a decision on the tax rate. After I present the budget, assuming there's no questions, before you actually approve the budget, you'll have to approve the actual tax rate for the year first. You guys have been at 3 cents tax rate for quite some time. It is, for the most part, has served you pretty well. I'll show you a little snapshot picture here in a little bit of how that served you over time. I'll go on ahead with the presentation of the budget for fiscal year 2022-23. Your year ended June 30, 2023. First, I want to show you how we got to arrived at our projected cash balance for July 1st, 2022. And how we arrived at that is we took our account balance as of December 31st, 2021, which was $315,813. We are showing we have a projected remaining tax receipts of $54,794. Just to make sure y'all understand where we are on the screen here, I'm going to highlight real quick, and then you should be able to follow me. But right here where I'm highlighting yellow just now, that's where we are on the screen here. We have a projected interest earned of $1,184 from checking accounts, factoring in projected tax receipts. Of course, the projected tax receipts are what we already went over. The projected tax receipts are a combination of delinquent telecommunications, real estate, tangible property, and motor vehicle for how much we're expected to receive the rest of the year from January 1st, 2021 to January 1st, 2022 to June 30, 2022. That would give you total funds available before remaining expenditures for this year of $371,791. The remaining projected expenditures for June 30, 2022 year ended is you're projected to pay your second half of the 2.8 cent fee to be part of the district. You already paid your first half of that fee back in late November, early to mid-December. And you'll pay your next part of that, the fee that's remaining here for the $116,078 sometime around May or early June to finish that out. We have remaining advertising and printing costs of potentially $288. We still haven't paid the audit fee yet for the audit. That they finished that audit up, I believe, around November, December, and we got the bill, but we didn't get the bill in time to get it through December 31st, 2021. So we still have to pay that. So you guys still have to pay the audit fee for this year. But once again, I told you that's a once every 4-year fee, so you won't be paying that again till 4 years again from now. There is projected remaining maintenance and repair of $22,526. The reason that seems pretty sizable, as you remember, is we normally budget quite a bit of miscellaneous costs in maintenance and repair to help cover HVAC fees in case those go out, or just random building costs. Obviously, with commercial buildings, if some big repairs can surprise you and randomly come through the year, so we always budget to prepare for that. Of course, anything that's not spent in those miscellaneous categories will go back into your budget. And obviously, I'm sure that there's a very good chance you won't spend all of this 22 remaining thousand, but just in case you do, we put it on there. You probably will more than likely spend the remaining dues and subscriptions that are owed to KPHA, SPG, and Calbo that were a part of every year. You probably will not spend your remaining board expense and miscellaneous. If you remember, this $500 that's shown here of this board expense and miscellaneous is your costs for having these meetings live in person, the food costs and everything that where we normally meet in person. But because we're on Zoom this year, we didn't really have to spend that. That doesn't mean there won't be something else come up that's miscellaneous that doesn't fit in another category that we might have to use this for, but more than likely going to retain this and put it back into your budget for next year. I will correct, there is apparently some printing issue when I printed this, but there's 2 blanks over here that are on the next category of building projects. I know that's factoring in here to the cost, but for some reason it's not gone to the right here, but I'll make sure and correct that before I post the official packet on the actual website. But you have remaining building projects left at $31,700, remaining furniture and fixtures at $2,750, and equipment, which once again has a built-in miscellaneous factor there that you may not spend, but can go back into your budget if you don't, of $14,663. That would give you a total estimated remaining expenditures for 2022 of $191,220. And that would give you an estimated opening balance of $180,572. So that's how we arrived at our beginning estimated cash balance for the upcoming beginning of the year, July 1st, 2022, as you can see here highlighted on this next page. As you can see, as normal, we break the budget into 3 categories. We give you a snapshot of what you have been, of the rates you've been using. That's the first middle column here, at current rate of 3 cents, which is what I'll be presenting to you. And then we give you a break-even rate and then a surplus rate. But for the last chunk of years, you guys have continually accepted the current rate. Of course, that'll be up to how y'all want to do this after I present here. Going for showing now your budgeted receipts. And once again, I'll be looking at this current column here. This current rate column is how I'm going to present this. Your projected real estate taxes for the year, $187,932. Your projected tangible taxes are $25,720, and motor vehicle taxes are $33,922. Those numbers, I'm sure this is something we go over each time with you, but those numbers come from the Office of Property Evaluation for Adair, and we take the numbers off this sheet, the real estate tangible and motor vehicle numbers, and we plug that into our calculation sheet here. We literally copy and paste these in right here. We calculate it based on your 3 cent rate, and then we base it on a 95% collection rate, assuming that maybe not all taxes will be collected due to whatever circumstances that might be. That's how we come up with these sets of numbers that you see here for real, tangible, and motor. And then delinquent taxes, as I tell everybody, these are the hardest to predict. They're very random. Some months you get $100, some months you get $800, so on and so forth. It varies from year to year. So it's really hard to project. So normally I project that based on what you have received through December of 31. And that's what I did this time. So this is how much we're projecting for next year, $2,449. And we are projecting your telecommunications tax next year to be $3,316, and your interest income from your bank accounts of $1,139. That would give you a total budgeted receipts of $254,479. And that would give you total funds available before budgeted expenditures of $435,050. Going now to budgeted expenditures. This is your normal, the first line is your normal 2.8 cents to be part of the district. That's calculated this year at $243,231. Normal costs like snow removal was budgeted $1,000. Landscape maintenance for fall and spring, $2,000. These are normal recurring expenditures. Miscellaneous maintenance and repair. This is the big miscellaneous column I told you that we budget, just in case there are some units go out or some bad things going on in the building. So we don't have to have a special call meeting to raise this. We normally put a good little padding in here, especially with the cost of buildings, repairs and everything going up. Nowadays, it's good to have a little padding in there. That would give you a total building maintenance and repair budget of $17,000. We budget our furniture and fixtures next. First being seasonal decor of $250, and then miscellaneous furniture and fixtures. Once again, just in case some chairs break, tables need to be replaced, so on and so forth. $2,500, giving you total furniture and fixtures of $2,750. And then we have our equipment category. There was a few separate items in this, but I'll go through first. Your miscellaneous computers and related equipment. If it says miscellaneous computers and related equipment, that means anything that may come up that needs to get replaced that's of an IT nature. So if it's a laptop, desktop computer, printer, scanner, fax machine, all things related to electronic and computer equipment would be in this 9,200 category. In case that comes up, as you can imagine, just replacing a couple laptops or desktop adds up pretty quick, especially like printers and faxes machines and things like that. Those are all pretty expensive items. The Adair County office did want to budget this year for an ice maker. That's another piece of equipment they wanted for the conference room. I think theirs has gone bad, or is about to, or is already gone bad, for $1,400. Kitchen supplies, just various things to use in the kitchen, utensils in the kitchen, $600. This generator maintenance fee is a fee you'll continue to see every year. If you guys remember, you guys have an automatic generator. And that to maintain that, to check on it, we have a guy that installed it to come out once a year and check on the fluids and to make sure everything's topped off and to make sure it's running properly. We do that once a year, and this is what we pay him to do, that annual maintenance check. And then we have a miscellaneous equipment. This would be anything else that we are not foreseeing that is not IT equipment, like a medical refrigerator or something like that may need to be bought during the year, that randomly, like I said, gets broken or whatever, to have that in your budget. For total equipment cost of $16,700. As I said up there, you don't have to have an audit next year until 4 years from now. So we didn't budget anything in your professional services this year. You have an advertising and printing cost recurring of $300 budgeted. Dues and subscriptions that are pretty normal once again each year for Calbo, SPG, and KPHA of $1,500. And hopefully, once again, we get to start having in-person board meetings, this would be the $500 to cover the food cost for that board meeting next year. That would give you total budget expenditures of $281,981, with a balance remaining in cash of $153,069 and a net deficit of $27,502 before optional expenses. The county is asking for an optional expense this year to be budgeted. Apparently, there is needing to be a major repainting of the walls and trim done on the bottom floor of the building. It's apparently gotten in pretty bad shape. For $11,000. Any questions you have about that can be directed at Shannon. I'm sure she can help assist with why they're asking for that. Let me check on something real quick. Here is, if you can see on this page right here, here's one of the painting quotes here. As you can see, we don't have 3 quotes yet. We didn't have time to get that, but we're budgeting 11,000 because we figured that's probably the lowest it will be. And we'll obviously, if you guys do approve this, we will have to get 3 quotes when we do this painting job, and of course we'll use the funds appropriately and choose the one that is the lowest bid. But the 11,000 would be a worst case for the painting of the wall and trims and floor. If you do accept the optional expenses, that'd be a total budget expenditures of $292,981. That would give you a cash balance remaining of $142,069 with a net deficit of $38,502. And as I've explained before, I know that looks a little glaring, that big red number, but as you can, as I've explained to you, if you don't spend a lot of these miscellaneous computer and equipment during the year and this miscellaneous for maintenance and repair, that'll probably more than likely bring even with your optional expense, bring your total down to more like a net deficit of like a -15 or -20,000, somewhere around there. So not as bad off as you would think. And to prove that, I wanted to show you really quickly, your trend over the years. As you can see, you technically have averaged a surplus down here at the bottom. Some years you have a surplus, like this past year of 19,601. The prior you had a deficit. The prior 2 years you had surpluses. It's gone back and forth. So as you can see, technically your rate, has served you pretty good. But as you can see, you've been mostly break even over the last 10 years if you average it all out. But that is the presentation of the budget. I can take questions on that, but this will be the part, if you don't have questions for the budget, to move for the setting of the tax rate for the year, or budget year 2023.
I'm not sure, Matt, are you still on?
Yeah, I'm still here.
Okay.
Does anybody have any questions or discussion or a motion to approve the tax rate at any of the given figures?
Ron, I thought we painted up there last year.
I think we did the first floor, and this is looking at the basement, the conference room and the offices in the basement level this year. Am I wrong, Shannon? Is that right? I see you shaking your head.
That is correct. The top floor was all done, clinic rooms and everything, and the basement is the conference rooms and all the offices that are down there.
Okay.
That is an optional expense on the budget. So if once you set the tax rate, then you would have the choice to make the motion to approve the budget as presented with or without the optional expense. So that's up to you how you proceed with that. So the first item of business, I guess, would be to set a tax rate.
I'd like to see us keep the same rate as we did this year.
It's been a pretty good break-even budget for you historically. So the motion then would be to leave it at 3 cents per 100.
Do we have a second for that motion?
I'd second that motion, Dr. Parton.
We have a motion and a second. Do we have any other discussion? If not, all in favor can say aye. Any opposed?
Aye.
Looks like the motion carries. So I guess at this point we move forward to accept the budget as presented, or do we have any discussion about that?
At this point, like I said, I'll take any questions you have on the budget. When you make a motion for the budget, like I said, like Amy was saying a second ago, you will need to make the motion to accept the budget with or without the optional expense of painting the walls and trim.
I'll make a motion to approve it with the optional expense.
Okay, we have a
I'll
motion. Do we have a
second that.
second?
I'll second.
All right, all in favor of accepting the budget as presented with the option, say aye.
Aye.
Do we have any opposed? All right, looks like that motion carries as well.
Okay, the next item then on the agenda would be term expirations of board members. Shannon, do you have a list of who's going to be expiring?
I do. We have Chantilla Rexroth, Leanne Jesse, Jacob Burton, Debbie Cowan, and Sherry Hutchison. I did speak with Dr. Rexroth. She wasn't able to make it on today, and she has asked to exit the board. I haven't spoke with Sherry, is the only one not on, but I haven't heard from her.
So the remaining ones of you, Jacob Burton, Leanne Jesse, and Debbie Cowan, would you continue on serving on the board, or do you wish to come off at this time?
I don't mind to continue.
Okay,
I'll stay.
thank you. Debbie, thumbs up or thumbs down? Oh, you can unmute. Okay, good. Okay. They're all good to stay, Shannon. So we'll need to look for a replacement for Dr. Rexroth, and you'll need to reach out to the other board member. I'm sorry, I'm blanking. Is it Sherry?
Sherry.
Okay. And verify her. This is an online process now for the board resubmissions of your information. So Shannon and Lakeisha, and I was going to introduce Lakeisha whenever it got to my turn for director's comments, but Lakeisha is the clerk there in the office day to day running the operations, and Shannon's helping out, pitching in and kind of running between Adair and Taylor both at the moment. So Lakeisha or Shannon, either one can help you walk through the process of renewing your term closer to the end of the calendar year, I believe is when we typically do that. So as long as we know you're willing to continue, they'll reach out to you at the appropriate time and get that taken care of. Okay. So we will need to look for a replacement for Dr. Rexroth. The board has to be made up of a certain composition of representation, and one of the disciplines that has to be represented is a vet, and I think that's where Dr. Rexroth had been filling that vacancy. Is there another vet in Adair County who you think would be willing to serve, or that we could reach out to? Was she the only vet there? Does anybody know?
No, there's more.
Okay.
I'll try to check with some of them.
Okay, if you wouldn't care, see if we can recruit someone, and if not, there is an option that says that if no one is available to fill such a position, then the Cabinet for Health and Family Services can appoint a resident layperson knowledgeable in consumer affairs in lieu of such a vacancy. So there's an option if we can't recruit a vet to do that. So since we don't have a replacement candidate today, we may have to have a special called board meeting to do so at another time, but that should be a very quick vote once we have someone identified just to do that. Okay. The next item on the agenda is the election of the chairperson and officers. And I believe that Dr. Rexroth had been serving as the chair of the board, and Matt Jackson had been the vice chair. So we will need to consider both of those positions. Matt, are you able to talk, and are you willing to continue to serve?
I am able to talk, and I would be willing to continue to serve. I would prefer to remain as the vice chair. Somebody would be willing to step up and be the chairperson.
I'm sure we'll have lots of takers on that option.
We should have voted before the quorum, I told you.
Yes. There's also the issue of the secretary for this board. Mr. Crabtree has typically been the secretary for the local boards, and as such, he's a he would have been a non-voting member. And the benefit of having someone like him or myself in that position is that I'm able, or he would have been able, to sign some paperwork and do some business on behalf of the board that doesn't require chasing all of you all down for signatures and doing some things. So if it's the desire of the board, I don't care to continue serving in the secretarial role. As I said, it would be a non-voting member. I would just be here to facilitate and help the process speed along. So we'll need to have a motion on a chair, a secretary, and then the vice chair. Matt says he's willing to continue on. So we would need some nominations for a chair, I guess, at this point. Is anyone willing to step up and serve? I promise it's really not so scary.
Will Matt take it?
He said he would prefer to stay the vice. Matt, would you consider being the chair if we could get you a suitable vice?
Yeah, I'd be okay with that.
Okay. Do we have someone willing to be a right hand to Matt?
I'll do it if no one else will.
Thank you, Jacob. I could tell you were just jumping at the opportunity.
Just couldn't wait.
Okay, so then we would have Matt to serve as the chair and Jacob Burton as the vice chair. And then I had put myself out as an option for secretary unless you all choose to do something else. So that would be your slate of officers. If you all choose, we would be ready for a motion, I guess.
Motion.
Okay. Is there a second?
I would second.
Okay. Matt, you want to call for a vote then?
Yeah, everyone in favor, please say aye.
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 Anyone jumping to oppose?
All right. Looks like y'all are on the hook for at least a year. All right. The next item on the agenda then is board members to serve on the district board. And Adair County has the judge executive by default. That position is automatically a district board member. And then you had two other members serving, and that had been Matt Jackson and Dr. Rexroad. So we'll need to replace Dr. Rexroad on the district board also. It does not have to be Jacob Burton, but it could be if he wants to do that as well. The district board meetings are quarterly, so it is a little more often than once a year, like this local board meeting. It's quarterly, and they have been virtual since COVID began, and it is scheduled for March of this year, also virtually. But then we're looking at the June meeting, which would be our district planning and budget approval meeting. That one we are hoping will be back in person by then. So that's your all's choice on who you propose for your board members, the district board representation. That's just a little summary of how it operates. So, Matt, are you willing to continue to serve as on the district board as well?
Yeah, I'll continue.
Okay. And is there another person who would want to volunteer for Dr. Rexroad's position on the district board? Does anybody want to nominate anyone? You can put him on the spot. Okay. Jacob, would you be willing to do that as well? You're muted.
Sure.
I thought
As
I
long as I
read
don't
your
have
list.
as long as I don't have youth sports to attend, I don't mind to go to the meetings.
I understand. I have the same issue, so
Yeah.
I understand.
That's fine.
So, is there a motion then to accept those board members to your representation to the district board?
I'll make the motion for that. Debbie.
I'll
Thank you.
second it, Janelle Brown.
Thank you.
Favor say aye.
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 Any opposed? All right, motion carries there as well.
All right. Thank you all very much for your participation and your willingness to serve. I know it's tough. We all have a lot of hats we wear and a lot of demands on our time. So I do greatly appreciate your time. The next item on the agenda is director's comments. Matt, if it's okay with you, I'll just be very brief with a few comments and then we'll adjourn. You okay with that? Can I continue on? Okay, I hear no objection, so I'm going to roll right in. Just want to introduce myself. It's kind of odd. I've been talking and carrying on a lot during this meeting, and some of you all may not even know me. My name is Amy Tomlinson. I'm the district health department executive director and was actually appointed last June, and I overlapped for 6 weeks or so with Mr. Crabtree. And then he fully retired on July 31st of last year. So I became solo director on August the 1st of last year. And that was right around the time of the Delta surge of COVID. And then that went kind of down. And then we rolled right on into Omicron. And it's been continual COVID since day one for my tenure as director. I'm looking forward to the day when it's not COVID and it's other things that we can focus on and have some attention on. But I could not be more proud of our health department staff during the pandemic and during the response of that we've had to mount over the last 2 or 3, seems like 3 years, 2 years, I guess, of the COVID mess. But the Adair County staff have worn many hats and they have done a lot of different things, from enforcement of the governor's mandates early on to case and contact investigation, isolation and quarantine recommendations and guidance, vaccination clinics, outreach to our partners on guidance and ways that they can help. It's just been continual stress on the health department staff. And I just want to say thank you from the bottom of my heart for them. Could not have done it without any of them. And I'm really, really proud of them. So it's more than just COVID. The health department, even though we've been doing COVID for 2 years, nothing else has stopped. We have continued all of our regular services on limited basis. And we've done things like WIC, diabetes programs, smoking cessation. The health education team is back in schools doing the schools programs, as Jelaine had mentioned earlier. It's continuing on. And there is light at the end of the tunnel. COVID numbers are starting to come down. Vaccination rates are not exactly where we would hope they would be for a lot of our communities, but with natural immunity that people get from COVID and between that and our vaccination rates, I'm hopeful that there are better days ahead of us on this and that we'll be turning the corner and able to go back to more normal functions very, very soon. One of which would be in-person meetings again. I would love to get the opportunity to come out and meet you all in person and talk to you. So I look for that soon. While I'm new to the role of the department director, I'm not new to the health department in general. I've been here for over 17 years and I've had lots of different jobs within the health department. So I appreciate the opportunity to serve and to lead in this capacity at this time. The health department, I want to throw this out to you all as just a final comment. The health department is a 10-county district. Our district is the largest district in the state as far as number of counties, and I believe geographically also largest district. We're also the longest serving continual health department as a district. So we started in 1971 with 5 counties, and 5 additional counties came on in 1982. So from 1982 until now, it's been 40 years as a 10-county district. And that is a major milestone for it's an unheard of thing to have the partnerships that we've had in place for that long and to be able to work together. So I just wanted to thank everyone for that and to advertise that we're going to probably this summer, as long as COVID allows, do some sort of a celebration for our communities to let them know that we've been around for 40 years and that this is a major accomplishment for everyone, for the communities and for us, and that we are committed to serving our communities, continuing to serve the communities for, the foreseeable future, as long as funding and time will allow. That's our heart and our goal is to serve our communities. So if you all have any questions for me, I'm always available. Shannon and Lakeisha both have my cell phone number and my office number, and they can get you in touch with me. I thank you for your service, and I'm willing to take any questions or comments that you all have at any time. Is there anything you all need from me today or have questions or comments today that I can address?
Oh, Dr. Barton?
No question.
Okay.
All right, thank you.
Thank you, Dr. Parton. Anyone else have any questions or comments? If not, I will turn it back over to Matt, and he can adjourn us, I suppose.
Can I do that, or do we have to have a motion to adjourn?
I think we usually do a motion to adjourn in a second.
I will make the motion to adjourn.
They move it all the time. I can never figure out what.
Do we have a second?
I'll second.
Thank you guys for everything, and I guess you can cast your vote by exiting the meeting.
Thanks, everyone.
Thank you.